Cardiology covers various cardiovascular diseases, including rheumatic heart disease, RHD. RHD affects heart valves and can have severe complications if untreated. We will explore RHD's causes, pathogenesis, diagnosis, and treatment in this video. Rheumatic fever, RF, is an autoimmune disease caused by Streptococcus pyogenes, which is transmitted through respiratory droplets. Prompt recognition and treatment of strep throat can prevent RF development. The pathogenesis of RF involves a complex interplay between bacterial antigens and the host's immune response. Molecular mimicry is a vital mechanism in this process, whereby antigens on the bacterial cell surface share structural similarities with host tissues, particularly heart valves. This resemblance causes the host immune system to generate cross-reactive antibodies, ultimately leading to the damaging autoimmune response seen in RF. The precise molecular mimicry mechanisms, including the involvement of M proteins, have been extensively studied and contribute to our understanding of the disease's pathogenesis. Inflammation plays a central role in the progression of RHD. In response to the immune-mediated damage caused by RF, inflammatory cells infiltrate the valve tissue. This infiltration triggers a cascade of events, including the activation of cytokines and chemokines, recruitment of immune cells, release of matrix metalloproteinases, MMPs, and proliferation of fibroblasts. Collectively, these processes result in valvular remodeling, fibrosis, and ultimately, valvular dysfunction. The severity of inflammation correlates with the degree of valvular damage and subsequent clinical manifestations. Upon exposure to streptococcal antigens, the immune system generates a robust antibody response. The production of anti-streptococcal antibodies, particularly anti-streptolysin O, ASO, and anti-DNase B, ADB, serves as an essential diagnostic tool in the evaluation of suspected RF cases. Elevated titers of these antibodies indicate recent infection with gas. However, it is vital to consider that antibody titers may take several weeks to rise following an acute streptococcal infection. Rheumatic heart disease is a major global health issue, mostly affecting low and middle-income countries. Developed nations have seen a decline in cases due to better living conditions and healthcare access, but RHD persists in resource-limited areas. Certain regions like Sub-Saharan Africa, the Indian subcontinent, and Southeast Asia are disproportionately affected. Socioeconomic factors significantly impact the incidence and prevalence of RHD. Limited access to healthcare services, including preventive measures such as antibiotic prophylaxis, contributes to the persistence of RF and subsequent development of RHD in disadvantaged communities. Additionally, overcrowding, poor sanitation, and limited resources for early detection and appropriate management further propagate this disease in vulnerable populations. Recognizing the socioeconomic determinants of RHD is essential for effective public health interventions and the reduction of disease burden. Age, gender, and genetics contribute to rheumatic heart disease, RHD. Children and young adults, especially females, are most susceptible due to their immature immune systems and vulnerability to molecular mimicry mechanisms. Certain HLA genotypes also increase the risk of RHD. Carditis, characterized by inflammation of the heart muscle and the inner lining of the heart chambers, endocardium, is a hallmark feature of RHD. Inflammation primarily affects the mitral and aortic valves, although other valves may also be involved. The cytokines and immune cells released during this inflammatory process promote the destruction of collagen, which compromises the structural integrity of the valves. Myocardial involvement may lead to myocarditis, which can manifest as various cardiac abnormalities, including arrhythmias and congestive heart failure. Rheumatic valvulitis causes inflammation and scarring of heart valves, mainly the mitral and aortic valves. This leads to thickening and fusion of valve leaflets, causing stenosis and regurgitation, which can have significant consequences on cardiac function. The severity of valve damage determines the need for medical or surgical intervention. The diagnosis of RHD relies on a combination of clinical history, physical examination, and diagnostic tests. A thorough clinical history should include information about previous episodes of streptococcal pharyngitis and any cardiac symptoms. Physical examination plays a critical role in assessing heart murmurs, which are often indicative of valvular involvement. Additionally, echocardiography, particularly transthoracic echocardiography, TTE, is a valuable tool for evaluating valve structure and function. TTE can identify valvular lesions, assess severity, measure valve regurgitant orifice areas, and guide management decisions. The diagnosis of rheumatic fever is based on the Jones criteria, which include major and minor criteria. These criteria help identify the presence of certain symptoms and signs associated with the disease, such as carditis, migratory polyarthritis, and Sydenham's chorea. Meeting specific combinations of these criteria, along with evidence of recent group A Streptococcus infection, confirms the clinical diagnosis of rheumatic fever. Proper use of the Jones criteria allows for early identification and treatment of patients, preventing further heart complications. The management of RHD involves antibiotic prophylaxis and anti-inflammatory therapies. Antibiotic prophylaxis aims to prevent recurrent streptococcal infections and subsequent RF episodes. Penicillin or other suitable alternatives are administered monthly or as per guidelines. Anti-inflammatory therapies, such as nonsteroidal anti-inflammatory drugs, NSAIDs, reduce inflammation, alleviate symptoms, and help suppress the exaggerated immune response in RF. In cases of severe valvular dysfunction, surgical interventions, including valve repair or replacement, may be necessary to restore normal cardiac function. Rheumatic heart disease is a global health concern. Streptococcal pharyngitis precedes RF development, with molecular mimicry playing a crucial role. Inflammation, immune responses, valvular damage, socioeconomic factors, age, gender, and genetics contribute to its complexity. Accurate diagnosis enables appropriate management strategies, reducing the burden of RHD worldwide.